There is a quiet moment that happens in the body after the age of 60, and most people never feel it. The same pill you have been taking for years, the one your body handled without any problem, can suddenly start to behave in a different way. Not because the pill changed, because your body did. And in some cases, that difference is not small. It can mean the difference between protection and risk, between staying stable and slowly moving towards something far more serious, like a heart attack or a stroke. What makes this so dangerous is that nothing feels wrong at first. There is no warning sign, no pain, no clear signal, just a silent shift happening inside your body while you continue your normal routine, trusting that everything is working the way it always has. Today, we are going to talk about 5 specific types of medications that, after the age of 60, have been linked to a higher risk of cardiovascular events, especially when certain conditions are present, or when they are taken the same way they were years earlier, without anyone stopping to reconsider. But here's the part that matters most. This is not about fear. This is about understanding what is actually happening inside your body so you can make better decisions moving forward. My name is Dr. Lee Wei. I am a medical doctor and physician, and on this channel, I take complex health topics and break them down into clear, practical explanations so you can better understand what may be happening inside your body and what truly makes a difference over time. If you find this kind of information helpful, you can subscribe. But more importantly, stay with me through this, because one of the medications we will talk about today is taken every single day by millions of people and almost never questioned. Now, to understand why these risks rise after 60, you have to start with something most people are never told. Your body does not process medications the same way it used to. And this is where things start to change as we age. Several systems in the body begin to slow down. The liver, which is responsible for breaking down many medications, becomes less efficient. The kidneys, which filter waste and extra substances out of the blood, also lose some of their filtering power. That means drugs stay in your system longer, sometimes much longer than expected, and when that happens, even a normal dose can begin to act like a higher dose over time. But that is only part of the story. There is also a shift in how your blood vessels respond. Your arteries become less flexible. The inner lining of your blood vessels becomes more sensitive. Circulation patterns change, and the balance between clotting and bleeding becomes more delicate. So when a medication interacts with any of these systems, the effect can be amplified. This is where people get misled, because the medication itself is not necessarily dangerous. It may have been completely appropriate when it was first prescribed. It may still be useful today, but the context has changed, and medicine, more than most people realize, is all about context. The same drug can be helpful in one situation and risky in another. The same dose can be appropriate at 50 and excessive at 70, and yet in real life, prescriptions are often continued for years without being looked at in detail. Not because doctors do not care, but because these changes happen slowly, quietly, in the background. Now here is where it becomes more serious. After 60, the risk of cardiovascular events like heart attack and stroke naturally increases. That is a known baseline risk. But when certain medications are layered on top of that, especially without adjustment, they can push that risk higher. Sometimes a little, sometimes a lot, and often without any obvious symptoms until something happens. That is why today's topic matters. Because we are not just talking about medications. We are talking about how your body interacts with them right now, at this stage of life, and more importantly, what you can actually do about it. Before we go into the first medication, there is one important idea you need to keep in mind. Nothing we are about to discuss means you should stop any medication on your own. That is not the goal here. The goal is awareness, because when you understand how something works, you can ask better questions, you can have more informed conversations with your doctor, and you can avoid staying on autopilot with something that may need to be adjusted. Let us start with something very common, a medication that many people take without a second thought: often for years, sometimes even decades. And yet after 60, it begins to behave very differently inside the body. The first one is a group of drugs known as non-steroidal anti-inflammatory drugs, or NSAIDs. This includes medications like ibuprofen, naproxen, and even some prescription-strength anti-inflammatory drugs. They are widely used for joint pain, back pain, arthritis, and everyday inflammation. For many people, they feel like a simple solution. You take one, the pain eases, and you move on with your day. But inside the body, something else is happening. NSAIDs work by blocking certain enzymes involved in inflammation. That is what reduces pain. But those same enzymes also play a role in protecting your blood vessels and keeping blood flow steady. And this is where the issue begins. After 60, your blood vessels are already less flexible. The inner lining of your arteries is more sensitive to stress. When NSAIDs interfere with that protective system, it can cause a quiet tightening of blood vessels. That tightening raises blood pressure, not always in a way you immediately notice. It can be slow, quiet, but constant. At the same time, NSAIDs can affect how the kidneys handle fluid. They can cause the body to hold on to more sodium and water, and that creates extra strain on the heart. Now you have two things happening at once: higher blood pressure and more fluid load. For someone whose cardiovascular system is already working harder after 60, that combination matters a lot. Several large studies have shown that long-term or frequent use of NSAIDs is linked to a higher risk of heart attack and stroke, especially in older adults or those with existing cardiovascular risk factors. This is where people get misled. The relief is immediate, but the impact builds slowly. You do not feel your blood pressure rising in real time. You do not feel the added strain on your arteries day by day, but over time, it adds up. Now let us move to the second medication, because this one is even more subtle. It is a class of drugs called proton pump inhibitors, often called PPIs. These include medications like omeprazole, esomeprazole, and similar acid-reducing drugs. They are commonly prescribed for acid reflux, heartburn, and stomach protection. On the surface, they seem harmless. They reduce acid. They relieve discomfort. They protect the stomach lining. But here's where things become less obvious. Stomach acid is not just there to cause discomfort. It plays a role in helping your body absorb key nutrients, especially magnesium, calcium, and vitamin B12. Over time, long-term use of PPIs can reduce the absorption of these nutrients. That may not sound directly related to heart attack or stroke, but it is. Magnesium plays a critical role in keeping the heart rhythm stable. Low magnesium levels can raise the risk of irregular heartbeats. Calcium balance affects how blood vessels function, and vitamin B12 is involved in keeping blood vessels and nerves healthy. When these levels are disrupted over time, the cardiovascular system becomes more vulnerable. There is another layer. Some research suggests that long-term PPI use may affect the function of the endothelium, which is the inner lining of blood vessels. That lining is essential for controlling blood flow, clotting, and how vessels relax and contract. When it does not function properly, the risk of vascular events goes up. Again, this does not happen overnight. It builds slowly, quietly, often without clear symptoms. Many people are started on a PPI for a short-term issue, like acid reflux, but then keep taking it for years without anyone reviewing it, because it feels safe, because it was prescribed, because nothing seems wrong. But the longer it continues without review, the more these underlying effects begin to matter. Now this is where things start to shift from subtle to something much more significant, because the next two medications interact directly with how your cardiovascular system behaves under stress. The third one is a class of medications commonly used for sleep, anxiety, or calming the nervous system. These are known as benzodiazepines. Examples include diazepam, lorazepam, and similar drugs. They are effective. They can reduce anxiety quickly. They can help with sleep. For many people, especially later in life, they feel like a necessary support. But here is what is happening underneath. Benzodiazepines act on the central nervous system. They slow brain activity, which creates that calming effect. But they also slow down other systems in the body, including breathing, reaction time, and coordination. How does that connect to heart attack or stroke risk? As we age, the body becomes more sensitive to these medications. They stay in the system longer, they build up more easily, and their sedative effect becomes stronger, even at the same dose. Over time, this can lead to less physical activity, less movement, more time spent sitting or lying down. And that matters more than most people realize, because circulation depends on movement. When movement decreases, blood flow becomes less efficient. The risk of clot formation goes up, and oxygen delivery to tissues becomes less optimal. There is another layer. Benzodiazepines can also affect breathing patterns during sleep. They can cause shallow breathing, or make existing sleep-related breathing problems worse, like sleep apnea. When oxygen levels drop again and again during the night, even slightly, it puts extra strain on the heart. Now you have a combination: reduced circulation, lower oxygen levels, and greater vulnerability in an aging cardiovascular system. This does not feel dramatic. It feels like fatigue. It feels like slower mornings. It feels like normal aging. But underneath, the system is under more stress than it should be. Now we move to the fourth medication. This is where things become even more complex, not just because of what the drug does on its own, but because of how it interacts with everything else. The fourth category is certain decongestants and stimulant-like medications. This includes drugs containing pseudoephedrine and some combination cold medications. These are often used for sinus congestion, colds, or seasonal discomfort. Many of them are available over the counter, which makes them feel safe. But their mechanism is very different. Decongestants work by tightening blood vessels. That is how they reduce swelling in the nasal passages. But that effect does not stay limited to the nose. It affects blood vessels throughout the entire body, including the ones connected to the heart. When blood vessels tighten, blood pressure rises, the heart rate can increase, and the heart has to work harder to push blood through a narrower system. In a younger body with flexible arteries, this effect is usually tolerated. But after 60, when arteries are already less elastic, that added tightening can become significant, especially if someone already has high blood pressure or is taking other medications that affect cardiovascular function. This is where combinations become dangerous. Most people do not take just one medication. They take several: a blood pressure medication, a pain reliever, something for sleep, and then during a cold or allergy season, a decongestant gets added on top. Individually, each one may seem manageable, but together, they begin to interact. One raises blood pressure, another affects fluid balance, another slows the system down, and the body has to compensate. This is where people get caught off guard, because the moment something happens often seems sudden, but the buildup has been there for a long time. It feels like it came out of nowhere, but in reality, it was a gradual buildup of stress on the cardiovascular system. Now we come to the fifth medication. And this one tends to surprise people the most. Not because it is rare, not because it is unusual, but because it is everywhere. Taken daily, trusted, often assumed to be completely harmless. The fifth medication is low-dose aspirin. For years, aspirin was widely recommended as a simple way to protect the heart. A small daily dose, often called baby aspirin, was thought to help prevent heart attacks and strokes by reducing blood clot formation. In certain situations, that is still true. For people who have already had a heart attack or stroke, or who have specific high-risk conditions, aspirin can play an important protective role. But here is where things changed. More recent research has shown that for many adults over 60 who have not had a previous cardiovascular event, the routine use of aspirin may not provide the benefit people once believed, and in some cases, it may actually increase risk. Let me explain why. Aspirin works by reducing the ability of platelets to stick together. That helps prevent clots from forming inside arteries. But clotting is not just something harmful. It is also a protective mechanism your body uses to stop bleeding when vessels are damaged. After 60, blood vessels become more fragile. The lining of the digestive tract becomes more sensitive, and the balance between clotting and bleeding becomes more delicate. So when aspirin reduces clotting ability in this context, it can increase the risk of internal bleeding, especially in the stomach or in the brain. How does that connect to stroke risk? There are two main types of stroke. One is caused by a clot blocking blood flow. The other is caused by bleeding in the brain. Aspirin can reduce the risk of clot-related strokes, but it can increase the risk of bleeding-related strokes. After 60, especially without a clear cardiovascular history, that balance can shift. In some people, the bleeding risk begins to outweigh the protective benefit. That is exactly what more recent clinical guidelines have started to reflect. Many people started taking aspirin years ago based on older recommendations and simply continued. No change, no reassessment, because it felt like a safe preventive habit. But medicine evolves. What was once standard practice is not always the best approach today. This does not mean aspirin is bad. It means it is specific. It must be matched to the right situation, the right risk profile, the right person. Taking aspirin just in case, without knowing whether it truly benefits you, can create a situation where risk is added without meaningful protection. So what does all this mean for you? Up to this point, we have talked about 5 medications, each with a different mechanism, each affecting the body in a different way, but they all share something in common. Their risk increases when they are taken the same way, despite the body changing over time. This is where control comes back to you. Because the most important step is not stopping everything. It is understanding what needs to be reviewed. Here are a few practical things that actually make a difference. First, review your medications regularly. Not just when something goes wrong, but proactively. Ask your doctor or pharmacist, do I still need this at the same dose? Has my risk profile changed? Is there a safer option at my current age? Second, pay attention to combinations. Many of the risks we talked about are not from a single medication, but from how multiple drugs interact. Even over-the-counter medications, even occasional use, everything counts. Third, watch for subtle signals. Not dramatic symptoms, but small changes. Increased fatigue, shortness of breath, unusual dizziness, changes in your blood pressure readings. These are often early signs that something needs adjustment. And finally, understand that your body is not static. What worked 10 years ago may not be ideal today. That is not a problem. It is simply part of how the body evolves. If there is one thing to take away from all of this, it is this. The real risk is not the medication itself. It is taking it the same way while your body is no longer the same. After 60, your body is not just an older version of what it used to be. It functions differently. It processes substances differently. It responds differently under stress. And most importantly, it tolerates imbalance less easily. That is why, at your next medical appointment, instead of only focusing on new symptoms or new prescriptions, ask this one question. Is everything I am currently taking still appropriate for me at this stage? That single question changes the entire conversation. It shifts the focus from adding to evaluating, from reacting to optimizing, and often it opens the door to adjustments that lower your risk without removing the support you actually need. The difference between reacting to a heart attack or stroke and preventing one often comes down to small adjustments made early. Not one big change, not one dramatic intervention, but a series of small, informed decisions that keep your system balanced over time. You may not control every risk factor, but you do control awareness. You do control the questions you ask, and you do control whether your current routine still matches your current body. That is what makes the difference. Not fear, not avoidance, but alignment. If this helped clarify something for you, or made you look at your routine a little differently, consider staying connected to the channel, because this is exactly what we focus on here. Not quick fixes, not exaggerated claims, just clear, practical understanding of how the body actually works and what truly makes a difference over time. And if you know someone who takes medications daily, especially after 60, sharing this with them could make a real impact. Because sometimes the most important changes start with one simple realization, that what worked before may need to be looked at again. And once you see that, you start making decisions in a completely different way.